Hello and welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the California State Loan Repayment Program informational webinar. Before we begin, we want to make sure that everyone knows who this webinar is for. Today's webinar is focused on our State Loan Repayment Program, which is available to new and continuing applicants to the California State Loan Repayment Program. SLRP assists with the repayment of educational loans for healthcare professionals who commit to serving in federally designated health professional shortage areas, or HPSAs, or at federally qualified healthcare centers, or FQHCs. And SLRP is administered at the state level by HCAI. Today's agenda, I'm going to do some housekeeping and introduction, and then I'm going to hand it over to Daniela Perez, who will do the SLRP program updates, application process, and requirements. And then at the end of the webinar today, we're going to have a time for Q&A, and we will open up the chat for that. And lastly, before we begin, I'll do the housekeeping items. Number one, our webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. Number two, today the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And number three, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. Additionally, we will have all of our resources posted in the chat, links and everything that you can click on, including the slide deck. And so you'll be able to access those in the chat feature. And with that, it is my pleasure to introduce Daniela Perez, the Program Officer for SLRP.
Thank you, Christopher. Good morning, and thank you for joining us today. So my name is Daniela Perez, and I'm a Program Officer for the California State Loan Repayment Program, SLRP. I'll be walking you through the SLRP program's guidelines and application requirements. Feel free to ask any questions in the chat at the end of the webinar, and we'll be responding to those questions during the Q&A. So let's go ahead and get started. So the SLRP application release dates. So a few important dates to note for the SLRP is the application cycle is currently open and will be open until September 16th at 3 p.m. We'll begin to notify applicants of the award decision in December. A couple of things to note for this new cycle. Most of these changes took place during last year's cycle, but these are still some important changes to note. The most significant change is that this is a no match cycle, meaning that no match payment is required from eligible SLRP practice sites. Since it is a no-match cycle, applicants will not be selecting their practice site from an SLRP-approved site list on the application. Instead, applicants will enter their site address, and we will verify the site's eligibility as part of the review process. Applicants will also be required to submit a completed employment verification form, also known as an EVF, as part of the application process. Please keep in mind that both the applicant and the site administrator will need to sign the EVF. SLRP clinician requirements. So there are a few major points I want to emphasize on this slide. These slides are currently available on the SLRP site, and you can also find this information on our SLRP grant guide. But a few requirements to pay notice to, the first one being that you must be a U.S. citizen, U.S. born or naturalized. You must also possess a current unrestricted license to practice in California. You must also have no other existing commitments or service obligations to any other entity. You cannot participate in two programs at the same time. So please keep in mind that you may apply to multiple programs offered through HCAI, but if you are offered to participate in any of the programs, you will need to choose one program to participate in. You cannot participate in both. You must also be currently employed or have accepted employment at a SLRP-approved practice site. So in order to be considered for an SLRP award, you must confirm that you fulfill all the requirements found on this slide. So here are a list of eligible disciplines for the SLRP. I won't be going over each discipline right now, but please remember you can find this list on the grant guide, which will be provided to you in the chat. As a reminder, you must be currently licensed, meaning that associate positions are not considered an eligible discipline under the SLRP requirements. We'll be asking for a copy of your license as part of the application process. So service obligation requirements. You may apply as either a full-time or half-time applicant. The hours required and the award amount does differ between the two, and I will review the award amount in just a moment, but to go over the major work requirements, a full-time grantee must work a minimum of 40 hours per week. So even if your workplace considers less than 40 hours to be full-time, per the SLRP requirements, you must work a minimum of 40 hours per week to be considered full-time. 32 of those hours must be spent providing direct patient care. The rest of the time may be spent in an administrative capacity or spent performing practice-related activities such as precepting and teaching. But keep in mind that no more than 8 of those hours per week can be spent in an administrative capacity. One more thing to note is that a few disciplines such as OBGYNs, pediatric dentists, geriatric servicers, and mental and behavioral health care providers are required to provide a minimum of 21 hours per week in direct patient care. They must still work a minimum of 40 hours, but only 21 hours need to be spent providing direct patient care. The rest may be spent in an administrative capacity. For half-time applicants, the grantee must work a minimum of 20 hours per week. Depending on the discipline, the grantee must work a minimum of 16 hours per week in direct patient care. No more than 4 of those hours may be spent in an administrative capacity or be spent performing practice-related activities. As a reminder, there are some disciplines that require less direct patient care hours. The grantee will be required to work a minimum of 11 hours per week in direct patient care instead of 16 hours. The rest of the time may be spent in an administrative capacity. This only relates to OBGYNs, pediatric dentists, geriatric servicers, and mental and behavioral health care providers. We'll be verifying that you are meeting the minimum required of hours related to your discipline when we review your application. The SLRP award amounts. So one major change here is that the maximum commitment will be for 2 years. An awardee participating in a 2-year commitment as a full-time grantee may be awarded up to $50,000. For half-time grantees, the maximum award they may be awarded is $25,000, also for a 2-year commitment. In the past, there have been contracts with a 4-year commitment, but that is not the case anymore. Eligible debt. So to be considered eligible debt, these loans must be government and commercial loans obtained from qualifying lenders for undergraduate and graduate health profession degrees. We will request that you provide us with a copy of your most recent lender statement in order to verify that your loans are in fact eligible. As a reminder, they must be educational loans. SLRP site eligibility requirements. So in order for a site to be considered an eligible SLRP practice site, they must be a public or private not-for-profit entity. The site must also be located in a federally designated HPSA, HPSA, or FQHC. This is usually the area we get a lot of questions during the application process. If you're unsure if your site is located in a HPSA or FQHC, you're welcome to email us at the SLRP email, which we will share at the end of the presentation. Grant agreement deliverables. So I had mentioned EVFs earlier in this presentation. If chosen for the SLRP, grantees will be required to submit an EVF every 6 months or as requested by the program officer through the EAP to verify the hours worked and days missed. Do keep in mind it does list on the slide that you'll be submitting through the EAP, but there is a chance that that won't be the case. If there are any adjustments made, though, we will make sure to notify you. At the end of your grant agreement, you'll be required to submit documentation of payments made towards your eligible student debt. These documents should be submitted within 30 days of the grant agreement end date. Communication requirements. So please note these specified timeframes for reporting any changes. You are to immediately notify us if you are no longer employed by the approved practice site. You are to notify us within 30 calendar days prior to making any changes to your personal information, such as a name change, mailing address change, and so forth. You will also need to let us know within 30 days if your work schedule changes that will cause you to not meet your service obligation, or if you request to switch from a full-time to half-time status. So you are also to notify us within 60 days prior to taking a position at a new practice site or organization. If you make any changes to your employment status, or if you begin a leave of absence longer than 30 days. Please also note that you will be allowed to be away from the SRP approved practice site for no more than 35 workdays per service year. If you miss more than 35 workdays in a service year, we will extend your contract end date for each day of absence. Please note that this is per service year and not calendar year. SLRP breach. If a grantee fails to start or complete their service obligation, please note that you will be required to pay any amount paid by HCAI, as well as being responsible for the number of months of obligated service not completed. The formula stated on the slide, as well as the grant guide. An important thing to note is that the amount HCAI is entitled to recover shall be no less than $31,000 plus interest. Even if the breach formula results are lower, you will still be responsible for at least $31,000, if not more. If a grantee is breached, they will be responsible to pay the total due within 1 year of the date HCAI determines that the grantee went into breach. We, of course, want to avoid any breach of contract, and that is why we put into place the specified timeframes for reporting any changes. Please communicate with us if you're having any issues in completing your service obligation. We're here to assist you, and we welcome any questions you may have regarding your contract. So we have provided you with the SLRP website link where you may access the grant guide, the application, and where you may find our contact information as well. If you have any questions, please email the SLRP inbox, which is slrp@hcai.ca.gov. We highly recommend that you review the grant guide in detail, which can be found on the website link. So thank you for your time and for being here. I'll pass it back to Chris to take us into the Q&A session. Thank you.
Thank you so much, Daniela. As you can see, our team has put a lot of work into this program, and we're excited that you've joined us today to learn more. We're going to transition into the question and answer session, and the chat option is now accessible in the menu bar at the top of your screen. We do understand that some of you may not be able to access the chat feature in the browser version of Teams due to your organization's restrictions. Some find that the mobile version does provide chat access. If you're still unable to access the chat feature, please email your questions to slrp@hcai.ca.gov. Thank you for your understanding with that. We will answer your questions in the order that they are received and do our best to answer all the questions that you have. I see one person said they couldn't see the slides at all. If you're able to see the chat feature, you can see the webinar presentation link there, and you can click on that to see all of the slides, and we'll give that. So all right, let's jump into our questions here. First one, good morning. I was wondering if the primary care loan qualifies for this loan repayment.
So as long as they are qualified loans, as mentioned earlier, we will be asking, if you choose to apply, we'll be asking for your lender statement, in which then we would then verify that your loans are student loans, educational loans, and eligible debt. So you'll go ahead and provide your lender statement, and we'll go ahead and see if those loans are qualified.
Thank you, Daniela.
Sorry, Daniela, I'm going to chime in here. So primary care loans are loans that are, if I remember correctly, taken out during your residency. The state loan repayment program is intended to repay loans that are taken out for educational purposes. So I don't believe primary care loans do actually qualify for the program, unfortunately.
All right, thank you, Nathaniel. And just a reminder, for those that have their hands raised, we are doing our questions through the chat. If you're unable to access the chat, please email us and we'll be able to answer your questions. Next question, loan repayment program options for certified peer support specialists. I think the question is, do they qualify, or is there another option for them?
Certified peer support specialists won't qualify for this program. I'm not personally aware of any specific programs that certified peer support specialists do qualify for, but I would encourage anyone looking for any programs that they might be eligible for to head to the HCAI website and take our eligibility quiz that's available on the website. And that'll guide you towards programs that HCAI offers that you may be eligible for.
Absolutely. And we'll get that eligibility quiz link posted in the chat here so that you can find that easily. All right. Next question. For the section where we discuss loan balances, it asks for current balance. Would this be the current unpaid principal or the full current balance per loan as listed on our monthly statement?
So this is the unpaid principal or also outstanding principal balance.
Perfect. Thank you. Hello. If we have a private practice, are we considered a site administrator to sign off on our EVF?
Asking if you would have your site administrator sign off. Yes. Yeah, you'd have your site administrator sign off on your EVF. You'll also be signing the EVF as well.
I think the question is if they're a private practice, they would be their own site administrators is what they're asking.
Who they would have to sign the EVF.
Yeah, that's an uncommon one. This is something that's, to be frank, a new thing we're dealing with these no match cycles. I would encourage you, if you have the opportunity or the capability to have anyone else in your organization sign off on your EVF to verify it, only because we want to avoid conflict of interests on the EVF. We want to avoid any situations that look like perhaps someone is confirming their own, service obligation requirements are met on their own. We need a third party to help confirm and verify that. So if you own your own site, ideally you have other staff who can help with this, who can sign off on it. And then if we do think there might be an issue, we might contact them to verify these things. That's how I'd probably approach that. But do keep in mind, though, that your site does have to be in a HPSA or an FQHC to qualify for the program. So.
Excellent, thank you. The next one also ties into this. You mentioned that you must be nonprofit, so does a private practice not qualify?
Our practice might qualify. They do need to be a not-for-profit entity and also fulfill the other site eligibility requirements. So it may be, you would just have to verify that it does also fulfill the other requirements.
Thank you. For a half-time, it's $25K for the first year, but there are also extension years, right? Looks like $10K for each additional year.
Yes. Yeah, you could get up to $25,000 for the first year, and up to the $10,000. But you can review. We have the up to the extension year in the amount you can make in the the amount that you can receive from the award for each extension year. You can find that in the grant guide.
All right, thank you. Next question. Can telemedicine working with Indian health patients qualify? I work for a for-profit telehealth company focusing on Indian health.
No, that won't qualify for a couple of reasons. One, it's for-profit, and you have to be providing healthcare on behalf of a not-for-profit site. Two, and I'm making an assumption here, the Indian health patients, I'm assuming they're in India based on your description, and you do have to be working with patients here in California.
I believe it's Native American is what they're referring to.
Oh, that might be it too. I'm making an assumption based on it. If that's the case, then they'd be in California, but it's still a for-profit site, so unfortunately that wouldn't work. Otherwise, telehealth we do consider eligible. It's just got to meet the other site requirements. So.
All right, thank you. Clarification on the previous question about the primary care loan. She says that it was taken out during med school, not during residency.
Okay. Yeah, I mean, submit it. Like Daniela mentioned, we will review them. So, if there's ever any uncertainty, submit the loans. We'll take our time to review them during the application process. If we encounter any issues, we'll reach out to you. We give you a week to respond to correct any potential issues, and we'll go from there.
All right, thank you. And thank you for the clarification on that question. Next question, Karen asks, would a psychiatric nurse practitioner qualify to apply for this?
Yes, you should. If you're applying, there should be a drop down, and if psychiatric nurse is an option, then you could be able to nurse practitioner. Just make sure that you are licensed, because we will be asking for your for your license at the time of the application.
All right. Thank you. All right. Next question. Martin asks, I qualify for SLRP and another loan repayment program through HCAI. Can I apply to both? Is there a better chance of being granted one over the other? I also qualify for the licensed mental health professional program too.
Yeah, you can apply for as many as you want. If you are offered one, though, you can only accept one. You can't have multiple service obligations. I don't know if you have a better chance of being granted one over the other. So that's up to you to decide. But yeah, you may go ahead and apply, and then if you do get offered one before the other, you will have to make that decision.
Yeah, and to chime in on that, she's right. There's no way of us knowing whether one is, a better chance, because there are a lot of factors there. Available funding for awards, number of eligible applications we receive, the competitiveness of those applications. So we strongly encourage everyone to apply for every program they are eligible for. And just note that, in the end, you can only accept one award. So.
All right. Wendy asks, can you clarify frontline supervision? If I supervise clinical frontline staff, does that meet that criteria?
Frontline supervision. I'm assuming you're supervising at your work, so that would be considered admin care. So that would meet hours for the administrative care portion, not for the direct patient care.
Yeah, we keep it pretty clean cut. If you're providing direct patient care, hands-on care to your patients or through telemedicine, that's considered direct patient care. Anything else, we push under that umbrella of administrative care. So if you're supervising, even frontline healthcare providers who are providing the healthcare while you supervise them, that would be considered part of the administrative hours umbrella.
All right, thank you. Next question. Could I receive a prorated award if I work at a site for 1 year instead of 2 years?
No, you have to fulfill your full service obligation. So if it's a 2-year contract, you have to fulfill the 2 years.
All right. Wendy asks, loan balance principal only. We should not include interest calculations. Just list principal balance on the application as stated on our loan statement. I want to be sure I am listing the correct number on the application. How do we find the that's the second question. We'll get to that in a second.
Okay, yeah. So you're just gonna, on the application, you'll be asked to put in your balance. It'll be the loan, the outstanding principal balance found on your lender statement.
Then the second part is, how do we find the qualified site eligibility location? Is that in the guide? Is it geographical locations? I did review yesterday and did not find clarity to this question.
So we don't have a list. I mentioned in the presentation that there are several requirements for a eligible practice site. So you can go ahead and review that. I also mentioned too, if you're unsure, feel free to send us an email, and you're more than welcome to just go ahead and ask us, provide us with the full address, and we can see if the site is eligible.
And that is the best way to do it. HCAI does have a tool that can check for HPSAs and most FQHCs, but the most reliable way to confirm a practice site before you submit your application is just to email us and we will check for you. Barring that, you can just submit the application. We'll check your site eligibility as part of the application process and reach out to you if there's an issue. So.
All right. Next question from Winona. Are LCSW clinicians from county correctional facilities eligible?
One of the requirements is an outpatient facility, and correctional facilities, we've learned based on some guidance returned by the feds, that they don't quite qualify as outpatient facilities for this purpose. So.
Okay. If we are a private practice and the only employee, then who signs the EVF?
Yes, we answered this a little bit earlier, but we do recommend that if you are the supervisor, if you could try to find someone else who can sign off on your EVF, that would be ideal in this situation.
If you're the only employee and you have to sign it, you have to sign it. But but please understand that this creates a conflict of interest. And if we find any abnormalities, I suppose there's a small chance that a conflict of interest like this, if we find any abnormalities, could result in the possibility of a breach investigation. So, I understand you have no one else to sign the EVF. You'll have to sign it yourself, but just make sure you're meeting that service obligation, and we don't have any reason or need to dig further into it.
Right. Michelle asks, how often can I reapply for the grant?
Yeah, you can keep applying. We'll just verify that your loans are eligible, that you have eligible debt. And yeah, if you're working at an eligible site, you can just go ahead and apply as a extension grantee.
Yep, every year. Okay. You can submit a new application every year. So.
All right. Laura asks, what are some of the most common issues you see on applications that we can avoid?
We see a, yeah, we see a decent amount. One is the principal balance. Double check your lender statement. Make sure your loans are qualified loans. Also, the employment verification form, the EVF. Just verify that it matches what you're putting on the application. Sometimes the addresses won't match. So those are the big ones. Also, another one that we see pretty often is associates applying for this. I just want to remind everybody that associate roles are not eligible for the SLRP. You have to be licensed. So we will be asking for your license. And this is your practicing license, not your driver's license. We've gotten a couple of those as well.
We do get that. Yeah, that about covers it. Do note that if you have any issues, we'll reach out. The team reaches out, gives you 7 days to respond to correct issues. But those are the most common ones. If your site's ineligible, there's nothing we can do to correct that. We'll offer you the opportunity, but there's likely nothing. And if your license is ineligible, your discipline's ineligible, we can't do anything about that either. We will reach out to let you know and offer you the chance, but it's unlikely we can fix it. But yeah, those are the most common ones. And like she said, it's your medical license, not your driver's license. Please.
Okay. I think this is clarification question for the peer workers. Previously, this program under OSHPD had approved loan repayments for behavioral health staff members with federal student loan balances as peer workers.
It's not something I'm familiar with from my time with HCAI and OSHPD before that. I'm not sure which program you're referring to specifically. Federal student loan balance is a common loan eligibility requirement across many of our programs. So that wouldn't necessarily narrow it down. It's your discipline that's narrowing down the program, but I'm not sure which one it would be. And again, I would encourage you to take a look at our eligibility quiz, because that will run you through the possibilities of all of our current program offerings. So.
Yeah, and we did post that eligibility link in the chat, so you can find that there. All right, Wendy asks, how do we know if we're in a HRSA shortage area?
So I know the HRSA page does have a spreadsheet where you can see if the practice site is there, but the easier way would probably just go about sending us your practice site address, and you can go ahead and we'll let you know if the site is in a shortage area.
Perfect, thank you. Follow-up question on the frontline supervision. So then what is the frontline supervision as listed as part of your direct care definition on the FAQ page?
We don't have an FAQ page. I'm afraid you might be looking at an FAQ for another program, perhaps the federal level state loan repayment program, but the California state loan repayment program doesn't currently have an FAQ page or document implemented. So.
All right, and maybe if you're still finding trouble finding the answer, maybe just send us an email at SLRP, and we can get a clarification on that.
You can even send me the link to the FAQ you're looking at, and I can take a look at it as well, or my team can. So,
absolutely. All right, thank you. Where can we apply for the grant for psychiatric PA? Is there a mental health grant that we can apply to serve Native American patients? I am a psych PA and primary care PA, but this company is for profit. Are there any grants available to me? A friend sent me this grant info, and she's a recipient, so just trying to get more info. I think probably the eligibility. Yeah.
Yeah, I was gonna say, take the eligibility quiz. You could find, it's also on the SLRP site, the eligibility quiz. You can just click the link and then it'll bring you there. It'll ask you a couple questions, and if you're eligible for any awards, to apply for any awards through HCAI, it'll let you know which program.
And looks like we've got one more question on frontline supervision. Sounds like as an administrator, they would not qualify. Is there any grant opportunities for administrative staff?
Yeah, sorry, we're gonna have to point you back to that eligibility quiz again. We do apologize that we can't cite specific other programs, but different teams do handle different programs here at HCAI. So we're not always, completely versed in the different eligibility requirements for. We would encourage using that quiz to find a program that meets your needs.
Absolutely. All right. Lorena asks, for part-time, is it 25,000 per year for the first 2 years or 25,000 total for the 2 years?
It's 25,000 total for the 2 years. That's if you're a new grantee, that you can get up to $25,000. And then if you continue to apply as an extension, I know the first year and second year you could get up to 10,000, the third and fourth up to 5,000. So, and that's for the whole contract. You don't get that each year.
All right. Do you know when you will offer this type of program again?
Ideally every year.
Yep. All right. And then Emily asks, does turning in the application sooner make a difference if it will be granted?
No, as long as you apply before the close date, it doesn't make a difference if you apply early or later, as long as you apply on time.
And to build on that, the application decision process is based on scoring. You can see a breakdown of scoring in our grant guide, but we don't look at timing of submission. Submitting early means we'll review your application earlier and we'll reach out to you if there are any issues earlier, but you don't necessarily get more time to correct those issues than anyone else would. Still, we encourage it. We appreciate it. We like a nice steady stream of applications to review as opposed to a whole bunch at the tail end. But no, the actual decision is based on scoring, and you can check the grant guide for details on that.
All right. And next question, will the application dates be the same next year?
They should be. Yeah. We don't often change them. We moved our close date this year out one day further than usual because normally we close on the 15th of September, and that would have been a Sunday this year. So that can result in some minor changes to the application period, but we don't typically see any big swinging changes to the application period.
All right. Give a minute for any other questions to come in. We did reach the end of the list. Again, as a reminder, this webinar is being recorded, and we will be posting it on our webpage about 7 to 10 business days. Also, you can find all of the links in the chat, including for that eligibility quiz, which has come up several times in the questions. If you have any uncertainty as to whether you qualify or not, the eligibility quiz is a great place to start. All right, got some more questions. If we're trying to find a good work site, where can we do that?
I just put a link in the chat. That link actually points to the federal database of HPSA sites and FQHCs. They offer a few tools you can use to search for site eligibility, including just looking for sites that might potentially be eligible for this program. And of course, if you have a site you're looking at, you can always email us and we can check for you. But do note that neither the SLRP or this federal database helps with employment placement. It's not like all these sites are necessarily hiring. But if you find a site that is hiring, you may be able to use one of these tools to confirm its status and eligibility for this program.
All right, thank you. And Paul asks, is the webinar occurring later today the same as this one? Yes, it is. We offer 2 opportunities for those to have different schedules to be able to join in and participate. All right, well, We'll give just about 30 more seconds here. Again, if you are finding that you're having trouble accessing the chat, or if we've addressed your question, but you still have more questions that you need answered with that, go ahead and email us at slrp@hci.ca.gov, and the team would be happy to answer that. And looks like we're ready to move on. Thank you so much for participating with the question and answer session. Great questions as always, and we really want to make sure that we answer your questions. That's why we do these webinars. If you still have more, again, slrp@hci.ca.gov. And as a reminder, we will post this webinar in 7 to 10 business days. The slide deck is also on the webpage. We appreciate everybody joining us today to learn more about the California State Loan Repayment Program. We are excited to be able to offer it as just one part of our health workforce development efforts at HCAI, and are grateful for your participation with us today. You can see right now we have a resource slide up on the screen. We would love for you to sign up for our newsletter. We have a monthly newsletter that goes out that will keep you up to date on all of the things happening at HCAI as far as workforce development goes, and you can sign up for that at that. You can also contact us by phone or by email. You can follow us on Facebook, LinkedIn, Twitter, and YouTube, and lots of ways to stay in touch with us. We do encourage you to go to our website to discover all of the great resources that HCAI offers. As a reminder, the application cycle closes for this program September 16th at 3 p.m. And with that, thank you so much for attending. We are going to conclude today's webinar. Have a wonderful day.